President Donald Trump was diagnosed with what's called chronic vein disorder. You may have not heard of it, but it's actually pretty common among older adults. Joining us now is Dr. Greyson Mcgowin from Baptist South to talk more about this disorder. First, Dr. Mcgowin, though, tell us a little bit about what you do.
Sure. So I'm an interventional radiologist. We do the normal diagnostic training, and then we go on and specialize in minimally invasive surgical techniques as well. One of the things that we specialize here in the Montgomery area is treatment of superficial venous insufficiency, which, as you were just saying, has kind of been thrust into the limelight recently.
And it's more common than people think. Talk about the symptoms. How do we know if we have something like this or maybe one of our loved ones?
Sure. So it is fairly common. Unfortunately, it's fairly underdiagnosed and undertreated. Patients typically have issues with, obviously, varicose veins, pain, swelling in the legs, leg heaviness. You can also have skin thickening, or what we call hyperpigmentation, which is where the skin pigment becomes denser and thicker. And finally, you can even get chronic venous ulcers or chronic non-healing wounds on your lower extremities, usually down by the ankle.
What can we do to treat this? If we notice some of these symptoms, is there things we can do at home maybe to alleviate some of them?
Sure. So beginning at home, you can start out by elevating the leg. Weight loss is also something people don't like to hear too much about, but typically works pretty well. There's sitz baths that you can do. The thing that we really recommend, though, is coming in and getting screened for that. Baptist is actually offering free superficial venous insufficiency screening for the month of September. You can give us a call at 747-3810. And we'll be glad to bring you in. There's a questionnaire that you will fill out, and once you pass that, the next part is a quick ultrasound. It's painless. That gives us an idea of what's going on with the veins themselves to see if the valves inside that help prevent the blood from refluxing the wrong direction are actually diseased. And if they are, we have a number of minimally invasive procedures that we offer. Again, we begin with conservative therapy, compression stockings, weight loss, leg elevation, and then we move on to minimally invasive procedures if necessary.
What does that look like? You mentioned the ultrasound portion, but if you get the ultrasound, you sort of do that preliminary work. What does it look like if you say, this is a little more severe? What is the next step then?
So the next step, if the ultrasound was positive, like I said, we have to first do conservative therapy with the compression stockings and leg elevation. The next part would be to go over the patient the several minimally invasive procedures that we offer to best tailor what suits the patient, their disease process, and their wishes.
I know this is fairly common. How serious is it, though?
It can be serious. Typically, it affects quality of life. There's a lot of pain and swelling. But if you get to the point where you have the lower extremity chronic ulcers, you end up with chronic infections that can progress to having to go to the wound care clinic, which becomes a big issue. And that's one of the areas that we've seen a remarkable improvement. Patients come in, they get these procedures done. We fix their superficial veins, and believe it or not, many times those chronic wounds that they've been seeing about for sometimes years heal up in 6 to 8 weeks. It's really remarkable.
You mentioned weight loss, compression stockings at home, some things you can do. I know a lot of women like to get their steps in around downtown. Does walking help? Does that help?
It can help, but it can also aggravate the symptoms.
Okay.
We're dealing with, gravity is not our friend in this case. We're trying to get the blood from the feet back up to the heart, and those veins that usually prevent the blood from only going one way back up towards the head allow the blood to settle back down towards the feet. So it can be very painful, but obviously walking exercise is always a benefit in pretty much any scenario. You
mentioned free screenings happening in September. How can people take advantage of that?
So the best way is to give us a call. Like I said, that number is 334-747-3810. You can also find us on the website. It's baptistfirst.org. That can be a little bit more tricky to navigate. The phone number would be the best way.
If someone says, I don't want to wait till September, I think I need to see a specialist now, what can they do? What's the next step?
They can give us a call right now. We'd be glad to get them in and see them in a timely fashion.
Do they need a recommendation from a primary care doctor?
No primary care referral is needed.
Okay, so go ahead and give them a call now. Anything else you want folks to know about this?
That's basically it. Like I said, it's something that's very underdiagnosed and undertreated. It really makes a big difference when we improve people's lives. We get a lot of happy medicine hugs. Thank you for giving me my life back when we see people back and follow up. So definitely recommend people come in and get it checked out.
A lot of good information. Remember, again, free screenings in September. Just call Dr. McGowin's office. He gave us that number if you'd like to get in. Dr. McGowin, thanks so much for joining us.